Welcome back to another episode of Dentistry's Growing with Grace podcast. Join Grace and her guest of the week as they discuss lessons learned in the industry and explore unique insights into ethical growth.
Hello and welcome back to Dentistry's Growing with Grace. I am honored to have Dr. Michael Stella here with me today. Dr. Stella, thank you for joining me.
Oh, thank you so much for having me.
It's truly my pleasure. So in today's episode, we're going to talk a little bit about you and your journey, and then we're going to discuss charisma and if it's something that can be taught and how does it play into building a dental team. So I'm very excited for today's topics. To kick things off, Dr. Stella, tell me a little bit about why you decided to become a dentist in the first place.
Sure, great. Thank you for asking. I came from a bit of a medical background in my family, and I watched my dad be on call all the time when I was a kid, and he was like our soccer coach, and he would get a call and he'd have to run to the hospital, and we always had to have a backup coach, and some days he would be waking up and he would be really grumpy because he'd gotten 3 or 4 calls that night. And I said, shucks, there's no way I want to have that in my life, but I still want to be in a position where I can take care of patients. And so I eventually settled on dental school. And some of the heavy lifting on the research on that was actually done by one of my older sisters who went to dental school about 6 years before I did. And she had done a little bit of that research for me. And so that was really helpful. And then when I got into dental school, I decided that I wanted to do periodontics because for me, I wanted to do a lot more surgery than the average general dentist does. That was the part that I really enjoyed. I started having nightmares when I was a second-year dental student about waking up in the middle of the night, like trying to do class 2 fillings on the distals of upper second molars and gums everywhere and blood. And, it was just, and I went, man, that's not what I want to do my whole career. Obviously, it's not what most general dentists do for their whole career. But and I said, I got to do something else. I want to do surgery, but I wanted to maintain that idea where you get to be able to still see the patients every 6 months. You get to grow old with your patient base. And periodontics is really the only specialty that has long-term patient care where you're seeing those patients every 6 months. We have patients in our practice who've been there from the beginning 20 years ago, which is really, really cool to see how they've done. And they have kids now, and some of their kids end up coming to see us as patients. And so that part's been really neat. And so that was why I wound up in periodontics, where you still get to do all the diagnostics, all the treatment planning. You get to actually still do all the procedures, but you still all then get to see those patients long term.
I could see how that's the best of both worlds for you, personally. I chuckled when you talked about the class 2s, and I hear every time I talk to a dentist and I'm putting together like how we're going to market them, I'm always asking, what do you really enjoy? What do you enjoy the most? What services do you enjoy? And I think they're always taken back a little bit by that, and thinking that like, aren't I just supposed to do whatever comes my way? And it's fun to be able to highlight, what you want to do and what you're good at. But the specialty definitely solves that problem for you. How do you personally handle the unexpected? You've got this plan for your day or for your patient, and then something changes. What do you do in those situations?
I think I try to rely back on the experiences that we have. And obviously every time you do it, you learn a new solution, a new secret, a new trick. One of the things about having gone to as much school as we've gone to and so forth is that I feel like one of the chief things that the process of getting to and then getting through dental school is one of the chief things that it teaches you is to have that ability to think on your feet and to have some perseverance and have a little bit of grit. And that's why it's, as much as I complained about it at the time, for my friends who are out there, they know I complained a little bit when I was in dental school about it. but that perseverance that it teaches you, and that resourcefulness really would be the best term, I think, for it, is super important. What do you do when you walk into work and somebody's accidentally locked the door to the nitrous cabinet, and you don't know how to get into it, and you didn't even know there was a key to that room. That happened to me, I think, my third year in practice, and I was like, all right, somebody grab a shoelace and a paper clip, and we're going to see if we can get this thing open. And 10 minutes later, you're back in business, and you're running, you're seeing patients, and you've got the door open. And so that resourcefulness, I find, is really something that I think that most of us got it in school, at least to some degree, and you just have to try to make it work. And if you don't think you can do it safely, you got to reappoint the patient. But there's a lot of times where you can say, look, we can make this work. We'll get this taken care of. And then let's learn from this. That's what I always tell folks, is I say, look, we got it. We did it. Let's see what we can learn and what we can take from this situation, so that next time we don't have to wind up being quite so resourceful. Because resourcefulness, you can do it once a day. But if you're doing it multiple times every day, it can be really tiring.
Yeah, then you become chief firefighter, and you just jump from problem to problem to problem. My whole philosophy in my business is that the first time something happens, it's a learning experience. The second time, it's a mistake. So every week we actually have a meeting where we talk through every single learning experience, and then we update a policy, a protocol, or procedure based on that experience, so that it never happens two times. And of course it does. And that's where the management side comes in over the leadership side. You got to sometimes have those difficult conversations, but
sure. No, it's great that you've codified that. Yeah, we try to review those, but it's probably not quite as robust as your conversations are. But yeah, I tell all the assistants, look, the first time it happens, I'm never going to be upset, because we didn't know. I said, and there's no way you might never have known. And there's no reason that you could have known even. But now that we've done it, now that we've talked about it, let's make sure that one doesn't happen again, and so forth. So yeah, that's great that you've done it.
It's a big focus for us. We have thousands of different types of tasks. So if you think about like procedurally in a practice, apply that to like every website, every different kind of campaign that could possibly run. There's a protocol for every single thing we do, multi-step, multi-person protocol. And so, yeah, you really don't want to make one wrong keyword, one wrong town name, one missed box, and the whole campaign is shot. So that protocol is just like, I always tell my team, no one dies in marketing, which is good, because if we miss a step, we're not medical care providers. However, it can be very financially costly. So it's very important. But I love that advice. I love that resourcefulness. A lot of people, when they're faced with that difficult situation, they kind of take the deer in headlights approach until someone else enters the room to save the day. And I think in the medical setting, you really need people to act. Mm-hmm. You could literally, someone's life could depend on it in that environment, in that situation. And so having that resourcefulness and building that within your team, it makes you a safer, more reliable solution for patients. So I know we wanted to talk about charisma and talk about recruiting and some of the challenges in recruiting. What have you found in terms of the team members that you've been able to attract and retain? What are some of the qualities that you find, I guess I'll say, hard to define, hard to find, but when you do find them, you never want to let them go?
Yeah. So, I think I'm probably not the only person who would say that a lot of it comes down to the attitude of the person that you're working with. We've really found that, because obviously, like we were just talking about, nobody gets everything right the first time. So the person, and everybody in their interview, everybody accepts criticism well, everybody's a good team player, everybody brings good positivity to the office, all that stuff, right? the questions that you have to answer right to get in the front door. And I certainly would never begrudge people for answering those questions right, whether they're right or right. And so, once you get a chance to really get a chance to meet somebody, then that attitude really starts to take over, because there are a few things that we do in, some stuff you need licensure to do, some stuff you need credentialing, stuff like that. But the vast majority of the stuff that goes on in any small business, dental practice is not excluded from that. It can be done by a lot of different people. And if they have the right attitude and they have the right willingness to learn, they can learn it, and they can learn it on the job, as long as you have a good training protocol in place. And I think that that's one of the areas where a lot of practices probably, and I'm not accepting myself from this, where a lot of practices sometimes could do a little better job, is that onboarding. It's so important to establish the values of the practice, to establish the culture of the practice, and to establish that these folks don't necessarily know 100, none of them are going to know 100% what they're doing day one. And so it's so important to just establish who they're supposed to reach out to, who are the people who are going to be their resources, who can be a mentor for them. And then that helps them maintain a great positive attitude. And then once you find those people, fight like hell not to let them go. And so, like, for instance, in our practice, we have at least three people who don't even live in North Carolina, who we recruited originally, Haley included. You've met her, who were here, who were on site, and then decided they needed to move, and said, what the heck are we going to do? And I said, well, what do we need to do to try to hang on to somebody in your position? Because you're a person I personally like working with. And if that's the case, fight to keep them. And then one of the things that does is that gives you a reminder every day that the people we work with are the lifeblood of the practice. And obviously, like in my case, I have a business partner, and then we have some associates. And sure, the doctors are the face of it, but to your patients, that person who's at the front desk is the face of your practice. The person on the phone is, for our referring docs, somebody like Haley, who does a lot of our outreach, is the person that a lot of them think of rather than thinking of me. And if we can make their jobs as stable as possible, and have the loyalty and make things work for them as much as possible, then we all do better. And whether that means, figuring out how to do out-of-state taxes, which was a new thing for me, right? I didn't know anything about that. How to figure out whether somebody pays state taxes in state versus out of state, what all that is. And then working with your payroll company to do that. How to fund childcare for an employee who works off-site. How to play with your benefits to make them so that they are, so that they work well for the people the people you love, basically, that you work with every day.
I love that. A couple things you said just really stood out to me. When you're talking about how everyone interviews well, and everyone says, all the right things in the interview, but then when it comes down to it, things change. I've caught myself saying, you knew how to do this in the interview. I will actually say that to people. Well, when I interviewed you, you said you would have no problem doing this task. What has changed since, 2 weeks ago? And it really is that people research and they want to get the job and they think it ends there, but it really just starts there. And so as much as the person that you're interviewing wants you to be honest with them about, core values and culture and working hours, working conditions, benefits, they want honesty out of you. You've got to get that honesty from them as well. And I think honesty and attitude is everything. I also laughed a little bit when you said, I personally like working with you. I don't know if people realize how much that matters. Like, just coming in and doing the job, it's right. That's great. That's step one. But do other people enjoy your presence? Like, are you coming to work with a smile? Are you coming to work excited for the day? Or have you bought into this whole, oh, it's Monday. Oh, I got to get to Friday. It's like, what energy are you bringing to your team and to your patients?
Yeah, we had one of those a while back. I mean, how nice, right? That it's like 6 months since the last time I can remember thinking that to myself. But we had somebody on a Monday morning come in and go, oh, well, it's Monday. And I was like, I'm not going to talk to that person, but I'm going to get a manager to do it for me, And I was like, I'm going to smash that. And it was, and you don't want to, brush and gloss over people's personal lives and tell them that they have to plaster a smile on. But you got to fake it till you make it. And we don't get to have bad days. I remember when I was first coming out of residency, I talked to a buddy and he was telling me about a personal issue that he'd had a few years prior, and about how, he had just had to take about 10 minutes and sit in the back office and collect himself, and said, well, we're not allowed to have bad days. The patients depend on us. Let's suck it up and get right back to it. And that's kind of stuck with me. And I try to remind our team that, look, if you need a day off, you can take a day off, but you can't bring a bad attitude to work.
Yeah, it is really hard. I mean, it's also a habit of looking for the positive, looking for what you are appreciative of in your life. And it's where you put your mindset. Now, we're all going to have those difficult moments. We all lose someone we love, or our dog, or so, like, things happen that emotionally put you in a difficult space. You've got to be able to kind of check that and move forward. So I love that you mentioned that. I said dogs and they took it as their cue to start.
Yeah, I was thinking that might have been the case.
Charisma. I put a post on Facebook recently in my group. Can you teach charisma? And 90% or more said no.
Really?
Really 9 out of 10 said nope, you either have it or you don't. And I was kind of shocked. What are your thoughts on that?
I mean, I think for sure some people are born with what they call the gift of gab, right? But I think absolutely anyone can improve. Can you become Bill Clinton overnight? Probably not. Just thinking about people who had a lot of charisma in our history. But I think anyone can improve. And it comes down to that question that you asked earlier, where you said, do your coworkers enjoy working with you? And so if you then analyze your day and think to yourself, what were the moments where my coworkers really enjoyed working with me? And can I multiply that? And can I compliment people? And can I remember to look at their shoes and tell them their shoes look nice today? Can I tell them, can I notice when they get a haircut? Can I, all those things. It really makes your team and your patients, do you ask your patients if they had a nice weekend? Do you know where your patient is from, or are they just a name in a chair? All of that is charisma. And I think for sure, some people are always going to be better than others, but I think for sure you can practice it and you can improve it both in your practice, your professional life, but then also in your personal life as well.
I think so too. I started watching YouTube videos on how to improve your charisma.
Oh, great.
I'm known for being very, very honest. Sometimes a little bit too blunt with people, but most people really appreciate the honesty. But I just find it interesting because there are some videos out there where they break down celebrities and they show what they did in interviews and what they could have done better to be more likable to the audience. And it's kind of weird because you don't want to lose your authenticity. You don't want to lose your you-ness. But in the same token, I absolutely think it's coachable. And so, but I've started researching it. So I've seen it, but it's something to consider. And I think anyone who's in a patient-facing position should look into those kind of things and get comfortable with the small talk and knowing what small talk and where does that end and where does you're wasting everybody's time begin? So not just being able to connect, but how do you also stay, relevant to what they're here for and stay centered on their care? It's kind of a balance. So that's really cool that you have the mindset that people can improve on that and can be coached on that, because if they have the right attitude and they have the right core values, they can absolutely fit really well in a team.
Yeah, and one of the things that that we talk to say, for instance, our incoming docs about is that there's a significant element of your career that's going to be determined by how likable you are. Likability is another version of charisma. Are you working to be likable? And that's it's super important for patients. Your patients trust you more if you're likable. They'll then their experience will be a lot better. And in our case, we're a referral based business, and so you need the docs that you work with to like you and to back up what you say to your patients and so forth.
This is my last question. Where does likability, what are your thoughts on likability versus people pleasing? What are your thoughts on that?
I think you can do both independently. So I think that you can, even if you're giving somebody an answer they don't like, you can still be likable when you do it. You can be gentle. You can explain the reasoning behind it. One of the things that I always try to do when I'm talking to our team is I never tell somebody, I'm sure I have, right? I'm sure I have just told somebody to do something. When we're in a hurry, when there isn't time to explain something, if you think there's a brewing medical emergency, there may not be a lot of time for politeness or explanations. But I try to always then go back if I don't get a chance to do it on the front end. But I prefer to do it on the front end, is to just say, look, this is the zone we're operating in. This is the rationale for what we want to do and why we want to do it. And then now let's then talk about how we're going to do it, because then that's going to hopefully stick with somebody as a lesson, instead of just memorizing what they need to do in 1,000 different scenarios. If you provide them that framework for what they're supposed to do or why they're supposed to do it, then they can typically remember or figure out on their own better what it is that they're supposed to do. And I think that a lot goes into the idea of changing behaviors in a way that keeps you likable, or but without just being a people pleaser. Instead, you don't have to just say yes all the time, because if you just say yes all the time, eventually then you get to a point where that doesn't work, and now you have to change up, and people don't like it when they see you change. And so if you are a people pleaser, you eventually get to a point where you wind up with a bad outcome. And then you have to change it, and then you lose all that likability that you thought you built up. And so I absolutely would say that you can really split those two ideas.
I agree. I think they're two very different things. One, you're thinking about how people like you without thinking about. So likability, I think, comes from respect, like you said, explaining yourself, why you need something done or how you'd like it done and why. Whereas people pleasing is going to lead you down the path of not being consistent, which can be frustrating for people because they don't know what to expect. So I do think that they're sort of different. I have struggled with people pleasing, and it's so funny because whenever I'm talking to my dentist, or especially my specialists, there's always such a high level of perfectionism. It's kind of like this little thing that always is in the background, just there looking at you like, oh, could this be better? Could this be better? And I so relate to that. And I think when you have those tendencies, it's not uncommon to also have to be aware of the people pleasing tendencies that may come along with that perfectionism. But this has been a real pleasure. I really have enjoyed our conversation today. I know that you have an amazing team. You offer such high level care for your patients. And I know that you're going to continue to grow with the right team members as you expand continually. So thanks for being here with me today.
Well, thank you so much for having me. And I was going to say one last bit about that perfectionism. I absolutely see that. We absolutely have that. And there's no way to get away from it altogether. One of the things that really helped me in my career, I think, retain some of that positivity in the face of perfectionism, because perfectionism can be very negative. Was that I happened to, have a business partner who, especially when I first started, kept saying, "Hey, you don't think about the one patient in 100 who said something mean to your team. Think about the other 99 that everything went great with." And that was really, really helpful for me. And so if you're if you're joining a practice, maybe you have a great mentor like that. If you're starting your own or you're buying somebody out, it's definitely worth having somebody around who's a mentor, who has more experience, who can help remind you of those lessons.
I have those conversations probably weekly. The first time someone gets a bad review on Google, I'm there with those words. I'm like, okay, but you have 499 5-star reviews. So let's let this one go.
Yeah.
It definitely happens. Well, thank you so much for being here, Dr. Stella.
Well, thank you so much for having me, Grace. I really appreciate you.
My pleasure. And to our listeners, please join our Facebook group, Dentistry's Growing with Grace. Listen to our podcast on all the podcast platforms. And if you need any support with your marketing or growing your practice, you can reach me at grace@identitydental.com. Thanks so much and have a great day.
Thank you.